as an employee. He is not exercising his medical judgment and placing the interests of Michael Jackson first. Yes is what an employee says. Yes is not what a doctor says to a patient request that is not in their best interest.
And in your evaluation from Dr. Murray's own words and the evidence in this case, would you opine that Dr. Murray completely abandoned medical judgment in that regard?
Yes.
You found this to be, again, an independent, egregious violation that could have resulted in catastrophic outcome, namely death?
This did result in Michael Jackson's death.
Why do you say that?
Because if Dr. Murray had acted as a doctor, the very first time Michael Jackson said, "I need propofol to sleep," a doctor would say, "You have a sleep disorder, and you need to be seen by doctors who specialize in sleep disorders, not by having me show up with propofol." Every night when Michael Jackson was expecting to see Dr. Murray with propofol, Dr. Murray should have said, "Michael Jackson, I am not giving you propofol. I'm not giving you anything. You have a sleep disorder and you need to be evaluated by a sleep doctor." That's what a responsible doctor would do. It's not what happened.
Going next, Dr. Shafer, to informed consent. You talk about that in your April 5th report. You note that it's, again, an independent, egregious, as well as unethical, unconscionable violation. Can you describe for us, in your opinion, the importance, first of all, of informed consent, specifically as it relates to this case?
Yes. Were there to be an informed consent for this case, it would have involved the fact that propofol is not a drug that is used for insomnia. It would have involved the fact that nobody has tried administering propofol night after night for the treatment of anything, except perhaps sedation in the intensive care unit. Totally different environment. It would have involved the fact that the risk of death was very real. There's no evidence that this conversation took place. There's no evidence that Michael Jackson knew that his requests for propofol was placing his life at risk. But that's what informed consent requires. Informed consent requires discussions of alternative therapy. There's no evidence that discussion occurred. And it has to be written consent. Verbal consent is subject to the vagaries of memory or the possibility of the person not surviving. The consent has to be written. There was no consent, either the document or any evidence of a process of informed consent.
What is meant by a patient's right to autonomy as it relates to informed consent?
Your body is your own. Your life is your own. And you have the right to autonomy, to dictate what happens to your body and your life. That is a fundamental human right. Informed consent is medicine's way of respecting your right to autonomy, your right to make those decisions that are important and will affect your body and your life. Autonomy is a fundamental principle in ethics. And physicians, nurses, hospitals, healthcare institutions all recognize the patient's autonomy, the patient's right to make these decisions through the process of informed consent. The lack of informed consent denied Michael Jackson autonomy.
And would that informed consent, in this case, under these facts, include the requirement that Dr. Murray tell Michael Jackson in no uncertain terms that he may die as a result of what was taking place with the propofol?
Yes. I tell patients when I take care of them that there is a possibility of severe adverse events. And that's in the best of circumstances, and that includes the possibility of dying. That's part and parcel of the anesthesia consent process. This case being many, many, many orders of magnitude different because of the environment, the doses, the lack of competence in either managing sleep disorders or these drugs, placed Michael Jackson at huge risk. And there's no evidence that that was disclosed.
And when you talk about the right to autonomy, and you previously talked about the doctor-patient relationship, you're not saying that the right to autonomy would allow Michael Jackson to insist on propofol, with the result being that Conrad Murray then has an obligation to provide it, are you?
A doctor's obligation is to put the patient first, which requires the exercise of judgment, requires saying no when it's appropriate. Saying yes is not what doctors do. Doctors do what's best for the patient.
And the denial of autonomy, the denial of allowing the patient to be fully informed about, in this case, the risk of death, that's one of the reasons you found it to be both an egregious and ethically unconscionable violation of the standard of care?
Yes. Every night there should have been a consent, an informed consent, a written informed consent for the sedation every night, because it's a new procedure. And by not obtaining it, Michael Jackson was denied autonomy, denied the right to know the likely consequences, and to, for him, Michael Jackson was denied his right to make an informed decision.
You next talk, Dr. Shafer, about the requirement that Dr. Murray continuously observe the mental status of Michael Jackson. And you found that to be, again, an independent, egregious violation. What do you mean by the need to continuously observe the mental status?
When I am providing sedation to a patient, I'm right there, usually right at the head of the bed, unless for some reason they're operating on the patient's head or face, in which case I'm just to the side of the patient's head. But I'm right there. And I'm able to converse with the patient while they're getting sleepy. It may be that they're not fully asleep, and then I can chit-chat with the patient. I can talk with the patient. If the patient is at all uncomfortable, I'll say, oh, that's a little uncomfortable. Okay, I'll give you something more. But I'm right there with the patient, assessing the mental status, assessing how awake they are, how comfortable are they. And in the case of using these drugs for sedation, we're not looking for unconsciousness. We're not looking for general anesthesia where you can cut a person's body open and not have them respond. We're looking for an amount of drug effect, the power of the drug. We're looking for an amount of drug power here that is just enough to have the patient where they need to be and not more. But to give just enough drug and not more, you have to know where you are. You have to know how sleepy the patient is and whether or not they need more drug. And you stay right there with them at the head of the bed constantly.
And in your opinion, did Dr. Murray violate this fundamental requirement for the safety of the patient?
Yes.
And would you characterize it as Dr. Murray having actually abandoned Michael Jackson?
Yes, he walked out of the room.
You gave an analogy in your April 15th report of someone driving a motorhome down the street. Can you describe that and relate how that applies to this case?
Absolutely. An anesthesiologist or a physician giving sedation is responsible for driving this case, like a person driving a motorhome. If the person's on the freeway and is driving a motorhome and decides their bladder is full and they need to leave, you don't just get up from the steering wheel walk back to the bathroom, relieve yourself, and come back 2 minutes later, because it's very likely there's going to be a disaster. Because you're the driver, and you're responsible for steering that motor home on the freeway. And no matter how full your bladder is, you don't leave the steering wheel. Dr. Murray left the steering wheel.
In a setting where propofol is being administered, obviously you would have backup personnel if it was done properly, correct?
Yes.
And that would be one of the reasons, for example, the restroom or some type of need to leave the room.
In 25 years of giving anesthesia, I have never walked out of an operating room with a patient receiving an anesthetic drug, nor do I believe have any of my colleagues ever done that. I might, if I need to leave for some reason, another colleague will come in, and I'll give them a report, tell them what's going on, show them the vital signs, show them the drugs that are running. I'll say, I'll be back in a few moments, and I'll step out. And then I'll come back, and they'll tell me what happened while I was away. But not once have I walked out of an operating room with a patient receiving drugs, nor have any of my colleagues, to the best of my knowledge. Doctors don't do that.
Now, you talk about physically walking out and abandoning Michael Jackson. You also reference the period of phone calls that take place as evidenced by the cell phone records. Is that also, even assuming, let's assume Conrad Murray was in the general vicinity of his patient, is being on the phone in that manner with no other backup personnel independently an egregious violation and a form of abandonment?
Yes, it's a setup for disaster. The person receiving intravenous drugs, the healthcare provider is not at the steering wheel. They're not focused on the patient. Instead, they're talking on a cell phone, sending text messages, answering email. You can't multitask like this, even if you're a couple feet away, particularly because from a couple feet away, with no monitors in place and no alarms, a patient who is about to die does not look all that different from a patient who is okay, because nothing's happening. And you don't know that the oxygen saturation is dropping, and you don't know that breathing has stopped, because you're distracted while the patient is essentially dying. So you have to be right there. You cannot be distracted with all these other activities. And a period of 45 minutes, I think, speaks, that may be the wrong number, but that period speaks for itself.
You're referring to the phone calls?
Yes.
And what did you mean, or could you elaborate on the statement you just made about the patient might not look much different from presumably being okay to being in serious risk of apnea or death?
From a distance, it's not that easy to tell if a person who's lying down in a bed is breathing. All that happens is the stomach rises and falls a little bit. And from a distance, you can't tell if a person is breathing or not. At least, I can't. But that's the only thing that Dr. Murray had to look at from a distance. There were no monitors, there was no blood pressure. You can't see this little device on the finger that measures the oximetry. From a distance, Michael Jackson lying there not breathing doesn't look very different than Michael Jackson lying there breathing. And Michael Jackson could stop breathing for a considerable period of time and not have it be obvious to a person standing at a distance without monitors in place. So the possibility of occasionally looking over, seeing Michael Jackson, yeah, everything looks okay, when everything is very much not okay, I actually believe that is what happened.
Dr. Shafer, you also talk about, as it relates to observations, that there's the independent need to make constant observation and continuous observation